Okay, so what we're doing today is marking our hair transplant, and we're marking the hairline, which is one of the most important parts of this procedure. She wants a lower, more feminine hairline. And lean up one more time. One more forward, and we'll see the crown area. Oh, I see. Here it looks a little higher, but this hairline is just so much higher. So we're trying to keep it balanced. If we go too low here, it's gonna look very thin. So, but here, look, it already looks lower, but we're covering almost less than half the distance. So that's normal, okay? So we'll fill that in. Then in the central patch, you might not be able to see, but I'm gonna go down here and into the crown. Okay? It's gonna look amazing. So when we do a hair transplant, for this patient, we're doing a strip technique. So what we're going to do is we're going to numb the area, then remove the strip. So she's going to feel a little poke there. Good. See, our patient's very comfortable today. She's not feeling much at all. Excellent. And we're numbing the strip that we're going to be harvesting. All right, we're going to be doing the harvesting of our strip. Now, we're doing FUT today. Our patient doesn't want to shave. She wants to keep her hair long. So we're going to remove a strip from here, then we'll suture it up so you won't even see what we did. So we'll get a blade. And when we're cutting, we're going to cut on the bottom edge first so the blood drips down so it doesn't obscure our view. So we'll make our cut and we bevel the incision. See how flat I'm making my hand? It's so the incision can interdigitate. And we'll cut the top half. Thank you. Fresh blade, clean cut. See our patient's in twilight sedation today. She's getting some meds from anesthesia, keeping her very comfortable. Excellent. Now we'll remove the strip. We'll get a towel clip. Gently remove it, and this above the galea in the subcutaneous plane. Sometimes you get an artery that's bleeding. So when we get that, we stop it out of the pedal. Thank you. See that artery? Now it's stopped. Good. We'll continue the course. Some people bleed a little more than others, just depends on the patient. We're gently marching along. So this is the fascia there, we're staying above that. If you stay in a good plane, you don't get too much bleeding. So the same arteries will likely bleed on that side. This side, here it is. Dab right there, phone. Dab again. Good. There we go. Strip is off. And now we'll stop any big bleeders and we'll start suturing it. So nothing major, just a few skin bleeders. We'll do a running, locking suture and get this nicely closed. Very minimal tension. Now we're starting our second suture. And what we're doing now is we're tying our suture. We use a dissolvable suture to help minimize pain and discomfort after. Small tail. That's how you do a strip. So now we're going to be making the holes for our patient, our planned hairline, and we're going to feather it back to help fill in her crown. So what we're going to do first is a nerve block so she doesn't have too much pain. So I'm going to block the supraorbital nerve, the supratrochlear nerves on both sides, okay? So I feel the supraorbital foramen, which is right there. I go straight in on the bone, 1, 2, 3. And then I'll get the supratrochlear nerves right there. Fantastic. I put my finger to protect the eyeball. The supraorbital foramen, I feel it right there. There's a little indentation. 1, 2, 3. Go straight in. Now I feel the supratrochlear nerve right there. I don't feel the nerve, I feel the holes. And I know it's more midline, so I'll do that. So I'm paramedial here, and then I'm really in the midline right there. So now that's done, I'll do a test and see if she feels anything, and she doesn't. So now what we'll do is we'll numb the area where we'll be making the graft sites. All right, friends, we're starting with our grafts. We're going to start in the back towards the crown area and work our way forward because the blood always drips down.